Hello, I am Justine Witzke. After more than 15 years of working with patients in reproductive medicine, I'm now the founder and CEO of Aligneage Fertility. Aligneage Fertility is your boutique, human-centered sperm bank and fertility consultancy. And we're based here in New York City. And what I've realized over these last 15 years is that some of the fertility services available to our patients are overly transactional, and this is one of the most personal things that someone can do. And they should have the right team in place and people on their side. And with more than 25 IVF programs in the New York City area, there are only 3 sperm banks, and this really isn't meeting the needs of our patients, especially with exciting changes in family structures, a lot more single patients or patients in same-sex relationships seeking building families. And there's also been legislation that has allowed for compensated gestational surrogacy here in New York. So with all of these things combined, there's a need for a new facility that's focused on people, that's knowledgeable, open-minded, and really state-of-the-art. So what we'll be able to offer at Aligneage Fertility are andrology services. So semen testing, sperm freezing, directed donor testing and screening for intended parents who are using gestational surrogates, care for young men who need fertility preservation prior to some medical treatment that might impair their future fertility. And we'll be able to provide patient guidance and business-to-business consulting, patient education seminars, staff training, those sorts of things. I think that if we all do better, we all do better. And the people who we're really looking to help right away are our patients, of course, but we'll get to those patients by way of reproductive endocrinologists, oncologists, other healthcare providers, as well as employers, community groups, people who have, these constituents in mind. And the fertility market is huge globally, but something that's pretty interesting is within 30 miles of New York City, 17% of all of the IVF cycles done in the country happen there. So it is, there's a wealth of knowledge, but there's also a wealth of patients, and it means we need to rise to meet their needs. And these other facilities, they're busy, they don't have necessarily the capacity. And so what we're able to do is offer an alternative option and a novel approach to how sperm banking is done. We have alliances with advocacy groups, with employers, with surrogacy agencies already in place after years of experience working in the field. And the business is up and running in some ways. We were able to raise $450,000 through a friends and family round of fundraising. We have medical director and laboratory director on staff already, and we've given a soft launch, so the consulting services are available to you. This is the team. We're in the process of hiring a laboratory supervisor and a nurse practitioner or a physician assistant. We expect that in the first year we can break even financially, and that there could be quite a good amount of revenue within the first 3 years. And so what we're able to offer is this more human approach to sperm banking, to fertility consultancy, and make this process less transactional, more personal for people. And what we're able to do right now is offer education and support for patients, for professionals in the space. And we're looking to grow our team. We're looking to get referrals for additional people who we can help, and to close out the final round, final 50,000 of our round. With that money and with the money that we've already been able to raise, we'll complete the build out of the space, we'll complete the licensure, start to market a bit more, and build the anonymous donor bank. This model is replicable, it's expandable, and we're hopeful that that will be the plan. So thank you very much for the opportunity. I look forward to meeting with you at our Midtown location. Thanks very much. Bye-bye.